Next up, we will have Rebecca, the CEO of Seven Dimensions, sharing how to tie staff profiles into promotions and bonuses. Thank you for being here, Rebecca. I'll let you take it over.
Awesome. Thank you so much. And Beth, that was phenomenal. I think we need to be friends. Just straight to the point. I love auditing. I love OBM, self-professed super nerd in OBM. Absolutely love it. Uh, I'm Rebecca Urbano Powell. I'm the CEO of Seven Dimensions Behavioral Health. We are an ABA provider in Colorado. We are an Ascent-based practitioner. We do both day treatment, which is an alternative school placement for kids whose behaviors don't allow them to attend public school, as well as an ABA center. And we also push into schools in Colorado after we got a law passed to get medically necessary treatment in schools out here. Um, yeah, and so we are in Evergreen, which is about 30 minutes outside of Denver in the mountains, and then also up in Fort Collins, which is northern Colorado. And so we're serving families that would have to have like an hour-long drive to a provider if we weren't up in Evergreen. And that was our purpose. And like Sean, all about quality and making sure that the services that we provide are meaningful and impactful and are generalizing, because what's the point if they aren't maintaining the skills outside of therapy, right? And so a lot of that is what we focus on, is looking at our employee implementation fidelity and really investing in our team, because that is what's going to produce the best outcomes for our patients. And so I'm going to go over how we're using Hi Rasmus. We've been doing scorecards, like Beth has mentioned, for since we opened in 2018, and they earn performance-based bonuses based on their scorecard metrics with us for every position that they're in. And we also determine when they're ready for promotions based on those scorecard metrics. And we have a pipeline for every role that has those metrics spelled out and shared with the staff so that they can see what the expectations are at all times. They can log in and access their own data in Hi Rasmus, which we love. And it's really streamlined our efforts and has cut down on the time it takes me as the director to compile their data for scorecards. It's reduced by like at least 67%, if not more, as I'm figuring out how to become more and more proficient in this system. So the things I'm going to show you guys today that we've done here is we have started moving our RBT training and onboarding into Hi Rasmus. We have fidelity checklists in there for every type of position, as well as employee feedback forms. We do bi-directional feedback in our facility. We'll look at the promotions and how we have generated reports to automate the data analysis for those reports that the staff can access directly themselves. And then we've also rolled out recently a staff patient pairing kind of module, if you will, where we're looking at appropriateness of where the new hire skills are compared to the classification of that client profile that we're serving, to ensure reduction of having to make staff changes because it wasn't the right fit or that person wasn't quite ready. All right, so the first thing we're going to look at is employee data. And so we have a curriculum library just for different position data. And so looking at the RBTs, these are the different checklists that we have made for them. So they start out with a training checklist, which is in our employee training section of the library. And then once they pass that training checklist, they move into the fidelity checklist, because those fidelity checklists are directly tied towards scorecards. We don't want their training period to count against their bonus metrics. So that is calculated separately. These automatically pull into scorecard reports that we've generated in Hi Rasmus, as well as their promotion reports. And we also have a probation report that shows when they're ready to exit probation. And so again, like the position specific fidelity checklists are aligned with every single role in this company. The scores are tied to pay for performance bonuses that they can earn quarterly, and it helps us determine when they're ready for promotion. So it's very objective. And so within the library, we have the option to create skill acquisition templates to measure our staff performance, one of those areas being this fidelity checklist. And you've got, just like the patient-specific templates, your instructions tab, which we've taken advantage of to make it very clear to our staff what it is we're measuring and how we're measuring it. We use a plus-minus system for fidelity once they're out of training. In the training checklist stage, we are using the weighted checklist like Beth described as well, like requires prompting, etc. But once they've passed that training checklist, we are measuring, are they implementing with fidelity, yes or no, only. So it's incredibly objective. And then we also have the data recording, et cetera, which you can set up so that it will auto master targets or metrics as they're meeting that proficiency level that you want. So for us, it's 3 months mastery and maintenance, and then they're ready for the next promotion. All right, so for each role, we have individualized what those performance metrics should be as a leadership team. We sat down and broke out what would an RBT1 do versus an RBT2 versus an RBT3 versus a lead RBT. And what do we want that growth to look like? And what do we want that skill expansion to look like? Because we're training all of our RBTs as if they're going to become BCBAs because it just means higher quality RBTs and better patient outcomes. There's no negative to overtraining your staff. And so one of the things I love about this is that our employees get to log directly into their profiles and see their performance over time. You can see this RBT has some skills marked as closed, meaning that they've already met mastery and maintenance for that specific metric, and they're now working towards mastery of the other acquisition targets that are remaining. And so once this RBT masters and meets that maintenance criteria on this fidelity form, they're going to be eligible to promote into the next RBT level using the next fidelity form. So within our company, the way it works is that RBT needs to master and maintain their current form. So like if they're an RBT1, they have to master that for 2 months and maintain for another month. And then they can move onto the RBT2 fidelity checklist for their 1 month training period. And once they master those targets over 1 month, they promote into the RBT2 position. And then there's 2 more months where we're hopefully measuring maintenance over that time. And then they'll be ready to move to RBT3 metrics and start that training period. And so one of the things that we've really enjoyed about Hi Rasmus is the ability to create training libraries for our employees for the onboarding and ongoing training assignments. So for our staff, we're setting up onboarding training across 6 different days where it's linked, as you can see in the instructions here, links to video clips, SOPs, any material that they need, and also a quiz for them to pass this day. So they have to get an 80% post watching the video recordings, meeting with the trainers, and doing their in-person metrics, which we have as targets on this day. And so we're scoring the whole day over the period of time it takes them to complete those metrics. And then it pulls directly into their probation report, which I run for them every single week. So we can give them a report on how they're progressing towards passing probation. Our probationary period isn't time-based, it's performance-based. And we've had somebody pass probation within 60 days, which is pretty impressive. And that means they're now an RBT1 and enrolled in our pay for performance program. And so in addition to programs to measure fidelity and training metrics, you can also, like I said, create reports to compile your performance metrics to assist you in determining when that employee is ready for a promotion. It also helps you identify areas that might need more attention and support or ongoing training. And so I really love the fact that I can share this report directly in the system by requesting a signature. And so I know that they're reading it and that they're getting their feedback. And it's stored in that folder over time, so I can see their progression over time, which is wonderful. And again, they can directly log in. They know exactly where they're at. They know what they need to work on. And it's really streamlined that communication. It's also a great way for us to measure the staff that are really hungry to promote because they are seeking out more opportunities when they're seeing their data and their feedback. And those are the people that are advancing very rapidly into higher level positions, which is really great. And so one of the most recent additions that we've been rolling out, it's still in the very early stages, but as somebody that's been doing scheduling for 20 years, it's very painful, and everybody knows this. And staff matching and pairing is very difficult, especially when you have a new hire that you don't know very well. And so something that we decided to roll out, we're already using a very objective OBM hiring system where we are measuring specific metrics throughout the hiring period. We know what those critical skills are, which we've classified as must-haves in order to be hired, et cetera. And so now what we're doing is taking those scores and implementing them into a staff client pairing program where we've created a color coding system. We've got green, yellow, orange, and red, red being the most complex of our cases because we serve 0 to 21, and we are taking severe behavior patients that can't attend public school and that are being discharged from like an inpatient hospital program. And so being able to look at this client or this applicant's ABA experience, what profiles they've worked with before, and then we also do a tech fluency assessment with them during the hiring period where it's really basic technology. But what we found is if somebody struggles with utilizing technology, they're going to have a hard time managing a session, right? And so being able to assess things like, we want you to send us a Google Calendar invitation for your interview date and time with the Google Meeting link, just in case we have to move to remote because Colorado weather, you never know. We also have them send their references in a fake audit note with fake session data via Google Drive. We're looking to see, can they share a file from Google Drive appropriately? So basic technology, right? We use that as our starting point to determine what color coding of clients we can put them in training overlaps with, because we want to stretch them a little bit, but not too extreme to where they're going to get frustrated, especially if they're brand new to the industry. We don't want to throw them right on a really complex red colored client immediately. We might want to stick with the greens and yellows if they're brand new to the industry. And then we are doing a secondary probe. So once they've completed about 2 weeks of onboarding and some client overlaps, we're re-looking at data. So we're looking at their fidelity scores on implementing the behavior plans. We're looking at their accuracy on the training checklist. And then we do tech assessments with them every week to help them become proficient in Hi Rasmus. So that way their sessions can be focused on the clients directly. So we're looking at those scores to kind of re-baseline where are they at. And that helps us pair them for ongoing client overlaps. And ideally, by the end of the 4th week, we'll be able to identify client assignments based on additional probes. And then we're going to reprobe after they pass their training checklist and just see how they do quarterly ongoing. And then we're going to be reevaluating our clients as well. Our client metrics are also very objective and based on behavior severity scoring that we have created internally, and also looking at regression that may or may not occur with the addition of new staff. So we're looking at like the critical skills. Are those critical skills like functional communication, assent, are those regressing when you put a new person on the team? Or is that client able to tolerate that change? And so that is how we're classifying our clients, and we're going to be rechecking that every quarter and doing that with our ongoing staff as well, which we will use in our scheduling periods that we do twice a year to determine appropriate fit. All right, and then we also are doing feedback forms like I talked about. We believe in bidirectional feedback, and so the RBTs give BCBA's feedback, the BCBAs give me feedback. I give the BCBA's feedback. That's how it works on our team. And it, again, very objective, just looking at are their needs being met? And so we are doing that weighted scale of a 1 to 5, 5 being you agree the most with that statement. The RBTs are giving their BCBAs at least monthly feedback for every BCBA that they're working with. And this is part of the BCBA scorecard. We also have a parent version where the parents are able to give their RBTs and BCBAs similar feedback, which is also part of the scorecard. All right, that's all I have for today.